Hello and welcome to the Business of Story. I'm Park Howell and I'm darn glad you're with us today. If you are trying to recruit, retain, and grow your membership for either an online community or a large association, and you want to replace your boring, rational promotions with emotional triggers to get your prospects and members to act, well, then this show is for you. Well, there seems to be light at the end of the tunnel for association and large membership organizations coming out of the pandemic as people and groups seem to be rebounding nicely. And if you're excited about training your membership or sales and marketing team on how to use the power of storytelling to make the impact in the world they're eager to make, then please let me know. I provide keynotes, in-person workshops, and virtual mastery classes that are entertaining, educational, and bewitchingly immersive with one singular goal, and that is to help your people excel through the stories they tell. If this piqued your interest, then please reach out to me at park@businessofstory.com, because storytelling is the secret weapon to grow your association membership and or community, just like today's guest knows. Sean Soth is the Leadership Advisory Board Chair of Professionals for Association Revenue, a member organization focused on improving association revenue health through community and resources. Sean says your success is based on how well you tell the story of your organization through the amazing stories found in your membership.
Our members have incredible stories to tell, from a hurricane knocking out all refrigeration in New Orleans and the doctors there taking their samples to deep freeze hundreds of miles away, or picking up patients that can't make it to the study and finding new ways to treat them. I don't think anyone really knew what a clinical trial was prior to the pandemic. Now many people do, but there's still a lot of questions. And what we found was that sites individually put patient care at the top of their list. And these are things that we were regularly going back to in terms of story.
Sean is a recognized business development expert who has led multiple sales portfolios in a variety of industries, including life sciences, legal, government contracting, association management, training and development, and healthcare. In these relationships, Sean's team surpassed budget objectives while launching new program and product development for thousands of clients per year. In addition to his role with Professionals for Association Revenue, or PAR, Sean is owner of High Fidelity Group, Inc., a managed sales and marketing firm focused on exhibit and sponsorship sales. And he's a co-founder of WebVent, a digital platform for webcast management and online directories for associations. Sean is a regular speaker at industry conferences speaking about the value of audience, business development, and marketing best practices. Today, we'll explore with Sean how story connects members and stakeholders to aligned outcomes, why your mission story matters to build emotional connection with your membership, and why every association director must embrace change to thrive in our ever-changing economy. All that and more with Sean Soth on today's Business of Story. Sean, welcome to the show.
Hey, thanks, Park.
You know, people ask me after 7 years of doing the Business of Story podcast, what else can you possibly talk about? Well, we've got a show today, that after almost 400 shows, we've never talked about how associations can use storytelling to grow their membership, to grow revenue, and basically to help increase their sustainability over the long haul. So I appreciate you being here to kind of explore that with us today. Sean, how did you get in the association business in the first place?
Probably just started by answering an ad, Park. When I was just getting out of school, there's not a whole lot of pathways that scream, hey, join a professional member association or a nonprofit group. and, follow your dreams, So there was an ad, and I seem to remember grilling my colleague, Carrie, at the time about what the job entailed. I had just a month or two previously answered an ad for a salesperson. And I always thought, basically maybe I'd be good at sales or business development. Long story short, on that first job interview, it involved door-to-door coupon sales, okay? And I think I spent my last $100 on the cheapest suit and dress shoes I could find, only to slosh them through the snow that week. So when I saw the job posting about association business development, I had a lot of questions. And what I learned was we'd be working with organizations that at the heart and soul of their business had a mission. And that sounded pretty amazing. It's almost like a unique value proposition cooked in there somewhere. Sometimes associations need a little help in helping to define it. But that was the start.
What is, in your experience, the biggest challenges associations have in just their either day-to-day marketing, membership development, or ongoing business models? What do you help them overcome?
Well, most of the opportunities that we have in association markets, the challenges that they have are really around catching up to 21st century operations. So think about if you were to work with a tech firm right now and talk to them about how they approach business development, man, you'd probably hear all kinds of great customer engagement stories and maybe market analytics. Associations have all of these tools. It's just that we've leaned on older business models. We're mission focused. So a lot of times that means repeatable things like attendee revenue and membership revenue. But for some of us, those recurring revenue streams were greatly interrupted during the pandemic. Those are the types of things that we're trying to help as we move forward this year and years to come. It's just helping associations understand there are great opportunities when it comes to aligning their business operations with some of their mission-focused work.
What's some of the lowest hanging fruit there that they're simply not picking yet, but if I'm an association director, I should be looking at? Because, all of our businesses, of course, were significantly impacted by the pandemic. My speaking world around in a lot of work with associations, basically completely shut down for 2 years, and now is just getting back on its feet. So we have all felt that. What are some of the things that people can do right away, to make 2023 an even better year than 2022?
So, Park, a lot of associations struggled in this area, especially sort of the mid or small groups that didn't have quite the reserves required to meet the need. So I think the first part of your question would be that we need to begin to diversify and develop. So diversify the way we approach business, not only from an event perspective and a membership perspective, but a business perspective. How are we inviting our business partners, our industry colleagues to the table and providing them the market they deserve? That's number one. Number two would be develop, and that's really around developing our teams to have a growth mindset in a way, be more entrepreneurial, find a scalable way to partner with industry to improve our education offerings, to just really engage the business side of our markets a little differently.
Can you give us an example of that? Like an association that has followed your lead on some of that, what they did and the impact it had?
Well, I could talk about my day job, which I'm super proud of, and that's working with the amazing life science industry at the Society for Clinical Research Sites. SCRS is a member organization that is basically exists to help clinical research sites be sustainable. Just briefly, in the life science industry, it is a bit of an ecosystem in a unique way. Sites are largely underrepresented because they are working to get the studies needed to move medicine forward. But they also do all the patient-facing work. And what happens a lot of times is that their business operations can be greatly impacted by decisions that may be out of their control. And so SCRS does a great job of giving those members a voice. And it's really been a privilege to work in that industry.
Real quick, Sean, so I completely understand this. And I know we have Marissa Hill to thank for connecting us because she works with SCRS. And Marissa, of course, has been a longtime colleague of mine while I was running my ad agency, Park & Co. And then when I transitioned into the business of story, she's one of the employees. She's a virtual employee now for me that came along and has been helping me with the business of story all along my community development. And so she introduced us, and I should probably have asked her this question before asking you. Can you? So I totally understand it. Are we talking about websites that life sciences groups are using for research and studies and that kind of thing? And you have a whole collection of these people doing it that have come together in sort of this association way? Do I have that right, or can you clarify that for me?
It's more than just a website. It's more like a community. And what do you need when you have a community? Well, you're looking to connect and support like-minded business professionals, in this case, with resources and connections and ideas that moves their business and in turn the industry forward. And so, yes, SCRS exists as a community of clinical research sites supporting industry partners and pharma to understand ways forward for clinical research sites' success. If you help clinical research sites succeed, it means that they're bringing in and engaging patients in a way that is equitable and moves medicine forward. And so our platform all along has sort of been, how do we mentor, educate, connect, and advocate for research sites so that they have a voice in the process. And what does that include? It includes websites. It includes 6 conferences a year. It includes content and newsletters, interviews, podcasts like the one we're sharing today, and a host of other resources. And yes, Marissa she's a force. She does a great job in connecting the community through content and communication, no question.
So you've got this community, and coming out of the pandemic, did they follow some of your leads here on developing their teams to have this growth mindset? Number one, let's start with that. And do you have some examples of where you've seen that in action with them, and what has been the outcome of that?
Sure. So we had a bit of a roller coaster with SCRS in starting a little bit, and I want to say that maybe if you kind of armchair quarterback it, the transitions and challenges that we faced as a team, in a way, prepared us for the interruption that COVID provided. And of course, no one worked harder than our members during that, throughout the pandemic, and still the case. But I would say that in 2018, we lost our founder, Christine Pierre, to ocular melanoma. She started SCRS from a very tiny little meeting in Florida that basically was not necessarily competitors, but like people that do the same thing in the market, talking about ways that they were just challenged to provide the care and service that they knew they could provide based on industry norms, things like non-equitable contracts, weird payment terms, not enough physicians to treat the amount of patients required, a lot of tech congestion and things like that. So SCRS was created to kind of wrap their arms around those things and begin to address them. And over 10 years, it grew and grew in different ways to provide those types of resources we've been talking about. When we lost Christine, we had a board member step up to help us continue. And it wasn't much longer after that COVID happened, and we were largely, like many associations, we leaned heavily on events to connect our folks, events to help support programs that maybe needed a little bit more underwriting than they could provide on their own. And so we lost that in a matter of weeks. And if you remember, I mean, it's just felt like, is this going to, maybe it'd be 6 months or so, and we'd be through the storm, right? But, us being an industry, we were hearing projections of exactly where it landed, maybe even longer. And so it was dark there for a while. And just like associations always do, and especially the members of our association, they came together to begin to support one another and share that support with us. They wanted to be sure that our programming was going to be interesting and innovative enough to kind of bring people together and continue delivering the kinds of messaging and ideas that people have become accustomed to getting at our conferences. So we created a program called Sites Now, and it pulled together, it met monthly. I like to call it like an amazing book club without a book. I mean, we basically picked up these topic areas that were really pertinent and meaningful each and every month to the market and the industry. Things that our pharma and other sponsor colleagues could learn from as well. And so what you saw was people responding to that, people keeping their investments with us. Maybe they would have normally invested in the events. They helped out with Sites Now and a host of other partnership opportunities.
And this amazing book club without books, was this a virtual, a monthly virtual gathering that they could jump on and have this conversation? So you were keeping them connected that way?
It was. And through other associations, we learned the value of, bringing a large group together, but then helping them connect in small groups. So we worked on the format constantly, tweaking it and trying to try new things. And sometimes, all the while getting feedback and support from our industry partners saying, hey, we like this. Could we try this next time? Maybe think of this topic. So what we learned was you needed to incorporate feedback from all the stakeholders. And that's something that we wanted to share with other associations. And that's kind of what we're trying to do with our colleagues through PAR. And so that's kind of the birth of that organization came through the hardships learned. And what we really wanted to say was, without that business and mission alignment during that time, it would have been a dark place to come from. I'm not sure we would have come through that. But what we were able to do was keep our minds focused on supporting sites at the time when they were needed the most, which was, the vaccine and other ongoing studies. These sites are tremendous, Park. If you ever get a chance to meet a research site, a team at a research site, you'll really see some of the most passionate professionals you can imagine. And we're really grateful to have the opportunity to bring them together when we can.
So these are professionals that are doing this research both online and in person, and it's just covering research across the scale in the life sciences, medical industry, big pharma, so forth. So how large of an organization is this? How many members do you have in it?
So we have nearly 10,000 clinical research sites globally, roughly 52 countries, give or take. And we host international meetings in Australia and Europe. And then we do 4 here domestically in the United States. We also do some therapeutic areas, which we're still learning, oncology in particular. And there's so much to learn, which is keeps us on our toes for sure.
And are you back to doing in-person events?
Gratefully, we are. So we took some of those lessons learned and began to build them back into our programming, figuring out new ways to serve value. And actually, if you're thinking about publishing or association markets, there are times when you're just, you're doing the same thing over and over again. And that's how you scale business, right? When you're selling widgets, you create the widget, you market the widget, you get better at producing, you get better at marketing, you get better at selling the widget. But when you're working with mission and people, those things aren't always predictable. So you have to begin to look at the way you're providing value to everyone that's on board. And those are some of the things that we've learned as we get back into those events. How can we try to create an atmosphere that helps everyone in those events do the very best and gain the takeaways they can use when they get home?
So it's interesting that you bring that up, Sean, because a lot of people, when I'm working with them, in either workshops or even doing keynotes, will come up to me and say, well, Park, I'm not in sales. I don't really have a product or service that I'm selling. I'm really more leadership and development of people and whatever. And my argument is, of course, you're always selling, no matter what you're doing, if you're trying to get someone to buy into, and in your case, a mission and a vision. So you don't have maybe this physical widget that you're selling through an association, but you have got to communicate the value of that mission and that vision for that particular member to write their check and to come in and get involved. How do you go about that, or how do you use storytelling to really convey that mission in such a critical, important way that you get people to sign up and then delivering on those storied promises, they stick around year after year as a member. But how do you use storytelling in that?
Well, for sure. I think in the association space, again, we're not exactly building the widgets that you mentioned. So in some instances, everyone's job is everyone's job. You have to dive in sometimes when it comes to tweaking and improving member or customer experience. And, there's an association for just about anything, and we've only recently begun to meet as people who are responsible for bottom line development at associations. We've only started meeting each other and sharing those ideas. What's working for you? And it isn't about the sale. It's about the sustainability of your projects and programs, and making sure, because 21st century business is changing, the people who used to just buy a booth or get a sponsorship, well, now they're looking at ROI, metrics. They want to be part of something. And so creating the right type of value proposition and story, boy, there's so many angles to take, Park. I think it's one of the most important things for our associations to learn and lead with is, what is your story? Why are you serving this market? What are you doing that's different from, where these folks are going professionally or personally in other areas of their lives? And why does it matter?
What is the story that you have developed around SCRS to communicate its mission and vision?
When Christine Pierre started SCRS, like I mentioned earlier, it was this small meeting, had maybe 2 tabletop exhibits, and I think the one I went to had about 100 folks. And what was amazing about that weekend was I saw people that I would presume were competitors. They basically do the same thing. Life science is a huge, huge industry. There's thousands of clinical research studies. But in this case, they weren't focused on just getting business. They were focused on making sure the business they were getting was optimal, that the study was going to not only be successful, so were the patients involved. That you saw them sort of take the narrative of what needs to happen to make that successful on their own. Our members have incredible stories to tell, from a hurricane knocking out all refrigeration in New Orleans and the doctors there taking their samples to deep freeze hundreds of miles away, or picking up patients that can't make it to the study and finding new ways to treat them. We have this sort of, I don't think anyone really knew not many knew what a clinical trial was prior to the pandemic. Now many people do, but there's still a lot of questions. And what we found was that that sites individually put patient care at the top of their list. And these are things that we were regularly going back to in terms of story. We had this really long mission statement, and it's like to be the voice of sustainability, and it goes. It's like it's a paragraph.
And nobody can recite it, right? Because it's so long.
No, exactly right. But what we came away with it was, what's the most important thing that everyone needs to know about the work that not only research sites, but industry wants to be part of too. And that was site success impacts everyone in research. So if you think of research as this ecosystem, pharma's got a new study that they want to produce. There's a middle market called the Clinical Research Organization. They're trying to figure out how to help pharma run the study. Then you've got solution providers involved in that ecosystem, and they're providing the software you need or the supplies you need, and even sometimes helping you gain the patients that would fit this indication. And then lastly, but not least, of course, is our clinical research sites in that ecosystem. And they're the ones that are patient-facing, and they're managing up, down, left, right. If they're not successful, I think you mentioned in one of your stories, like your dad taught you, the best contract or the best agreement in business is to make sure both sides win. And so that's exactly what our mission statement and value proposition evolved to. So it ended up becoming site success impacts everyone in research, period. It's something that we've allowed us to, inform our programs, inform the way we meet with industry, and so many other pieces of our work. It also keeps us focused, and it's something that everyone on the team can understand. It's simple and important. What do we need to do? We need to make sure sites are successful. Sometimes that means having uncomfortable conversations. Sometimes that means getting real about their capabilities and what needs to change. But in the end, that's what we're here for.
And when you say site, you're talking about where the study is actually taking place. So maybe you've got a bunch of researchers in Berlin, just to grab a city out of nowhere, and they've got a big study going on there, and they're bringing patients in. That is the site that you're talking about when you say site.
Yes, a clinical research site is an address where there is a physician and or team members conducting clinical research.
Okay. So you're very niched down then in this industry, right down, because you've got all these different players, as you mentioned, but the group you are talking to and working with are those absolute clinical research sites. Okay. And you said your UVP is sites?
Yeah, and then there's different types of sites. So there's academics like Johns Hopkins or, there's also, you've got private sites, standalone sites. You have cancer centers, you have networks of many, many sites like a provider network would have. So there's a number of different constructs to a clinical research site. And if you look at that value proposition of site success impacts everyone in research, what does that mean? What also means that they have work to do now, but also in the future. So you have to look ahead. And what's ahead? Well, there are things like our workforce is very, very challenged. There's not enough doctors in research to meet the need of the clinical research studies coming down the pike. And so we need to address some of those challenges. And we've got some great minds working on that now, inviting people into the workforce a little sooner. And this is all because of the associations, not just ours. There are many amazing associations in life science.
And do you do cross-pollination with these other associations as well? You work off of each other?
Sure, we like to. Oftentimes, different groups come together to share insights and perspectives, because when you're in an ecosystem, each of those groups has their own niche, right? And so their work is to make sure their members are informed and successful at their work, at their jobs. And so that collaboration is critical, and it's been one of the important stepping stones at the early part of SCRS, and continues to be that way as we move into 2023.
So you took this large, convoluted mission statement that probably no one could remember because it was 4 or 5 sentences long in a big paragraph. You boiled it down to site success impacts everyone in research. How has that landed with your membership? And then how do you use that singular narrative to build storytelling upon, to attract them in, or maybe the stories you are sharing at your various in-person events and conferences and that sort of thing? How does it direct you?
Well, one thing is it helps to organize maybe disparate businesses into what we're doing. So early on with SCRS, I can't tell you how many meetings we would have where someone at the end of the meeting would go, you know what, we don't sell to research sites. So with them, what's in it for me? Being part of the intelligence that changes an industry as life science is undergoing and continues to be going through. Well, it requires climbing this mountain together and having folks rally around that singular idea that site success impacts everyone in research. Well, it gives everyone a how, or what we need to be doing. So even if they're not working with research sites directly, they're part of the success factor of their product, program, service. It's how they're going to meet patients and participants. And so it's important to understand where clinical research sites fit into that ecosystem. So I feel like that value statement has been super helpful in getting us to the point a little quicker.
So that's one of the real big things for any association and or organization out there as you are building out your stories to find that singular narrative. What you have done there, site success impacts everyone in research. That becomes that singular brand narrative, your value proposition, and then you build off of that and support it through your activities, the stories you tell, how you communicate. And I guess it's also kind of a North Star. So people are asking themselves, well, why should I be a part of this again? Because I kind of am over here on this side. And you can say, yes, but the work you're doing affects everybody in research. And therefore, that's why you should be a part of this group.
I think so. I mean, in your story, in your brands, you want to have that North Star, that where people are headed. And the great thing about SCRS is our members help each other get there. They're each other's guides, and our role is to support that connection.
So, Sean, if you had an association come in and sit down in front of you, and you've got an executive director there that says, help, we are still reeling from the pandemic, and this could be an association in any industry. What are 2 or 3 things that they should look at immediately to regain their footing?
One thing that I've really enjoyed learning from Roger Martin, who is a business strategist and shares quite a lot on. You can find many books and sessions from him out on the internet. But I would say that something he shared recently was the difference between strategy and planning. And he said, planning, who doesn't love planning? You get to talk about your internal resources and all the inputs you've worked hard to have. And for many years, decades, a century, associations, what do? We do the same thing and we improve it here and there. But we got an annual meeting and we have a membership model and all of the things that associations have been doing to build bottom lines and then improve their mission or expand their mission and their reach over time. Well, it interrupted. And the strategy, Mr. Barton points out, is it's got angst. And the minute your plan meets with adversity, whether it's a customer, a member, or a potential constituent, that plan goes out the door. So you better have a solid strategy. And so I would say that associations need to begin to plan to win in the areas of the business that they serve. So don't lean on the fact that we've always been doing things the same way every single year, but move into the idea that you want to help your members win, you want to help move your mission ahead. And that may require some change and flexibility and adaptability on the playing field that you play on. So I love that teaching from Roger Martin. And I would say that understanding that you need a strategy is maybe the important first step.
Yeah, Mike Tyson, the famous boxer, had that famous line, everyone has a plan until they get punched in the face.
You got it. Exactly. Yeah. Mike was on
We've all had that, too, and the universe likes to punch us in the nose and go, okay, that plan didn't really work. All right, what's my next strategy around that? Good stuff. Well, this has been really fascinating. Sean, where can people learn more about you and the good work you're doing in storytelling around associations?
Well, I just would encourage anyone, no matter what business you're in. I always ask folks, like, do you still read magazines? I'm a magazine guy. I grew up in magazines. I love magazines, right? They're chock filled with great stories. Associations have this exact same model. They're producing great stories that are taking place inside their nonprofit mission, their member mission. Find out what associations operate in your industry. They're not only certifying bodies. Not all of us have a certification program. Some of them are really exist to help people understand more about everything from painting to art to disease. And there's something out there for everyone. But if you'd like to learn more about our work, it's mypar.org, and that's the Professionals for Association Revenue. We basically connect and support individuals who are responsible for building those bottom lines to make sure that their associations continue to move forward. And if you happen to be in life science and looking for a little bit more on SCRS, you can go to myscrs.org and learn more about the great work the Society for Clinical Research Sites is doing every single day.
And that first one was MYPAR, MYPAR, and that's for Professionals for Association Revenue. So mypar.org.
Yes.
Do I have that right? Good.
Yes.
Good.
Yeah.
And you're right, because with associations, what are you ultimately dealing with? Your widget are the members and the outcomes that you help create for them. So if you really need to have a tangible communication around your vision and mission and the impact you're having in these members' lives, tell their stories. I mean, you must have loads of these stories of people that you have helped, that maybe they were out floundering on their own and then they became a part of SCRS as a clinical research technician, and the impact that that's had on them. And then you, as the marketer, as the growth expert with that association, simply share their stories.
My career path to SCRS began with, the representing a handful of other great associations, training and development, government contracts, cost engineering, talk about as niche as you could get, home and garden. I mean, we've done so many different associations, but to your point about those stories, yeah, there's so many. And Park, I'll share one that I could think of is we were having this meeting right when we were kind of outlining the beginning of SCRS, what it was going to be. And one of the largest organizations in the life science space is a solution provider. They're called Metadata, and they do a number of amazing solutions, bringing technology into life sciences. And so we were speaking about this big plan that my colleague had for the future, the North Star that you were talking about. And I remember looking at Christine and I just honestly said to Glenn, who was the president of Metadata, I said, we just a complete we haven't, none of these are still baking. This is work that we still need to give guide rails to, and some operational excellence, has to be established. And Glenn looked, he goes, I'm a site guy, and partnerships take guts. I'm in. And I just remember thinking, sometimes you need to invite people in to where you're headed and let them be part of it. And that was a great lesson for Christine and I, just to know that now we have to continue to earn the trust of that investment that helped us kind of get started. And countless amazing organizations we've shared the unique paths to work together on.
Well, Sean, thank you so much for sharing with us your approach to building out associations. What do you see, last question here, what do you see the future for associations to be in the next 2 or 3 years, especially as so many of them are still climbing out of the impacts of the pandemic, losing membership, losing attendee revenue at conferences and whatever, and now having to earn that back as quickly as possible?
Well, I think the future's bright. I think events are going to come back, but if we haven't taken these lessons and applied them to not only our strategy, but the way we set goals for our organizations, then we're just going to find ourselves sort of buffering in between now and next. And I think you'll see there's a lot of amazing associations out there that are understanding membership dynamics are changing. Younger folks are looking for different ways to connect professionally, maybe not just letters after their name or joining a group. So, finding those pathways and experimenting a little bit, you'll see a lot more of that as associations learn and share that work together.
Awesome. Well, Sean, thanks so much for taking the time to being here. Really enjoyed conversing with you. Really enjoyed talking with you and having this conversation.
Hey, Park, I look forward to learning more. I think we could always work on everything, and who doesn't want to hear a great story? I really enjoyed listening to, as we prepared for this, getting introduced to your work, and I'm anxious to learn more.
Oh, well, thank you. And what we need to do is introduce your membership to the And But Therefore narrative framework. It's something that I've worked with Dr. Randy Olson, an evolutionary biologist out of Harvard who was a USC film school grad as well, and who has really made his life's work helping scientists like your clinical researchers understand how to use this basic framework of the And But Therefore to help communicate their big ideas in very simple ways and in ways that land where their messages land right the first time. And this can be anything from when they're drafting the initial clinical research program, what are we actually after here, what's the one problem we're solving for, to grant funding, to communicating their findings and how you can really own that room in under 15 seconds, getting them leaning in using this very powerful framework of the ABT, which I like to say uses the three forces of story, agreement, contradiction, consequence that our limbic, decision-making, pattern-seeking, buying brain absolutely loves. So would love to share that with you and your team at some point.
That sounds awesome. Maybe we can just flip the script and you can join us for one of our events. That would be amazing.
I'm all on board. Whether it's in person or virtually, just let me know. We'll make that happen.
All right. Sounds good, Park. Sounds good.
All right, Sean. And thank you all for listening to this edition. If you liked what you heard and you maybe are a part of an association that you think could be maybe doing a little bit better job in their communication and storytelling, share this episode with them or head on over to both of the websites that Sean mentioned, mypar, mypar.org, or myscrs.org. That's myscrs.org if you happen to be a clinical researcher and you're looking for your peeps to help you in your career. Check them out. And if I can be of service to you, come on over to the Business of Story. If you have not yet taken the quick online course on the ABTs of Agile Communications, you can right now at businessofstory.com/ABT. And of course, we have the companion book that goes with that, The Narrative Gym for Business, that crisp 75-page guide that will be your companion after and while you are creating these ABTs to help you truly produce stories that help you sell more. And it doesn't matter if you're selling widgets, products, services, or a mission or vision, as Sean had outlined here. If you are trying to get someone to buy into your way of thinking, feeling, and doing in business, then use story. It's the most direct access to the heart. That's where the decisions are being made. And then you can help them justify that decision in their logic-driven executive functioning brain. But it all begins by connecting with that heart on an emotional level using the power of story. So check it out. And until next week, when we'll have another amazing story artist right here for you like Sean, remember that the most potent story you'll ever tell is the story you tell yourself. So make sure that's a great one. Thanks so much for listening.